Thanks so much, Tawana. Well, we're joined this morning with a very special guest, Dr. Lori McNeil of Greenwood LaFleur's Hospital's OBGYN Associates. Good morning, Dr. Neal.
Good morning.
Now, I'm sure you are loaded with a lot of information that a lot of our viewers want to know, but we've got a few questions from viewers this morning. We wonder if we could ask you.
Certainly.
All right, fantastic. So being an OBGYN doctor, one of the questions that we are getting is, what are the current recommendations for Pap smear testing?
Okay, that's a good question because it's changed a lot over the years. Currently, through our College of OBGYN, they recommend actually no Pap smears for people under 21, and the current recommendations are every 3 years. So ladies are off the hook a little bit. Every 3 years between ages 21 and 65. However, they'll even raise that to every 5 years if you have your Pap smear with HPV testing.
Now, let me ask you about that. What is HPV?
HPV is a, believe it or not, sexually transmitted virus called human papillomavirus. There are over 100+ strains these days, and certain strains are more aggressive than others, and they can cause both cervical cancer and external genital warts. So mainly the strains 6, 11, 16, and 18 are the ones we're looking for that cause the trouble.
Now, when we talk about Pap smear and HPV, I'm just curious, how, for those out there that are like, well, maybe I should, maybe I shouldn't, how important is it that people get these done?
Very important, because it can be a preventable cancer, which leads me to I'm a big advocate of the Gardasil vaccine. That's a vaccine that vaccinates people against the most aggressive strains of that virus that cause both cervical cancer and external genital warts. The current recommendations are for all people, so guys and gals 26 years old on down. But we've been really targeting the pediatric population, the 11 and 12-year-olds, for some years. It's a set of 3 shots. It's given day 1 and at the 2-month mark and the 6-month mark.
And that's the Gardasil, right?
That's correct.
Now, talking about vaccines, and that's obviously a big debate all over the country. Are there any side effects, or are there any dangers that people should be worried about with those?
Well, really minimal. Obviously, you can get local reaction from the injections, sore arm, rarely fatigue, and flu-like symptoms, but the majority of people really pretty asymptomatic.
And the pros outweigh the cons.
Absolutely.
No question.
Absolutely. It's been a great stride for women's health care. It's
amazing. It's amazing. We've come so far. Let me ask this. If folks want to come and get more information from you, how would they do that?
Our clinic is across the hospital from our hospital, Greenwood LaFleur. Or certainly you can check out the ACOG, American College of OBGYN site. Or even one of my favorite websites is WebMD.
Yeah.
There's obviously a lot of false information on the internet, but that's one of the best.
One of the best, and then obviously check with your physician to make sure what you read is right?
Absolutely.
No question.
Check with your doctor.
And you can get more with Dr. McNeil at Greenwood LaFleur's Hospital, and you can just give them a call or check their website. Thanks so much for being here this morning, Dr. McNeil.
Thank you for having me.
Great information. We appreciate it.
Thank you.
Stay with us. We've got more coming up after our break. We'll be right back.
This Health Matters segment is brought to you by Greenwood LaFleur Hospital.